I got back MRI results, which show something totally different from my CT scan results when I originally went to the emergency room. Remember I told you that they found a compression fracture, or I had a cracked vertebrae at the T12 level. My T12 was cracked. Well, it turns out, well, it doesn't turn out. To me, I mean, I'm no doctor, but I read the reports and stuff from the MRI and from the CAT scan, and I either got 2 fractured vertebrae, which is all right. Let me just read this to you. The technique, the procedure was an MRI lumbar spine without contrast. The technique was a multiplanar T1, T2, and stir weighted image of the lumbar spine were obtained using a surface coil. The findings: there is a mild compression. Excuse me, I don't know how to read or speak, or I'm not too good at this, so just stick with me. There is a mild compression fracture of L1 involving the superior end plate. It demonstrates approximately 20% loss of vertical height. It is associated with marrow edema on the signal images, indicating that it is acute. Remaining vertebral bodies are normal in height. Marrow signal within the including bones are otherwise normal. The alignment of the lumbar spine, the conus, C-O-N-U-S position, and the paraspinal soft tissues are all normal. The L4 and 5 disc is mildly narrowed with small osteophyte formation, bone spurs. The marrow edema that I told you about a minute ago, where it says it is associated with marrow edema on the signal images, indicating that it is acute, that's arthritis and wore out joints, which my back, I guess there's joints in my back or something. So I got arthritis, wore out joints, I got bone spurs. Let's continue reading the thing, whatever. The L4 and 5 disc is mildly narrowed with small osteophyte formation, bone spurs. There is a 3 millimeter focus of bright signal in the posterior annulus of L5 and 6, compatible with an annular tear. Torn disc. This is not associated with disc bulging or herniation. The remaining lumbar discs are normal within the exception of moderate anterior osteophyte formations, bone spurs again. The spinal canal and neural foramina are patent, P-A-T-E-N-T, patent. There is a mild bilateral L4-5 facet hypertrophy. The remaining facets are normal. There is no spinal canal stenosis. Impression: mild acute compression deformity of L1 involving the superior end plate with approximately 20% loss of vertical height. An annular tear at L5 and 6. No herniation or stenosis. Note: the patient has 6 lumbar type vertebrae bodies. I have 6 vertebrae, folks, instead of 5. I have 6 lumbar vertebral bodies instead of 5. Most people have 5. Okay, I've studied a little bit on this on Google just a minute ago before I made this video, and 10% of adults have an L6. Well, I've got an L6, and it's right before S1, which is, I guess, your sternum. I don't know what the hell this is. I don't know what that is, but it's L1 is right below T12. So earlier, when I had the CAT scan, they told me T12 was cracked. That was when they did not know that I had a L6. So they were confusing, I'm hoping they confused my T12 with my L1 because they're right next to each other. So adding another vertebrae down there, if you count, that's actually L1, not T12. So hopefully I only have one cracked disc and not two. We're calling the doctor that did both of the radiologist that looked at both of my pictures, my scans or whatever, and we're going to ask him if he was maybe confused on the CAT scan, you know, because maybe the CAT scan didn't show the sixth vertebrae, which is a genetic abnormality of the spine. So I've been living all my life with a genetic abnormal spine. I've got an extra vertebrae. my spine's longer than yours. I don't think it makes me any taller, but it may be a reason for what I thought was a double jointed ding dong. For some reason, I have something in my penis that you can laugh all you want. This is a weird thing, but when I have an erection, I can pop my penis like a knuckle, just like that. I can pop it like there's a knuckle in it. I can crack it one time only. That's it. And then I can't do it again until I get the erection goes away and I can get another one. I don't know if that has anything to do with this or not, but I've got an extra down. I got some extra shit down here growing around. I may even have extra abnormalities in my other regions. Who knows? Like Courtney Kayla said on Facebook, she said, "I'm special." Well, I guess we are. We're all special in our ways, and I'm very special in a lot of ways, I guess. But now I've got an extra spine, and that just shows how much fucking backbone I do have. I've got a lot of backbone. But anyway, these types of things are normally treated with chronic pain medication or surgery. So this is just my back, folks. This is just for my back. It explains why I've been living with back pain pretty much all my adult life. It's because I've got some shit going on down there. I've got some shit going on. Bone spurs on my spine, a cracked vertebrae, and arthritis, worn out joints. I've worn my back out, is what it says. My back's wore out. So that's that part of that, the MRI part. Let's move on to urinalysis. Amphetamine, urine screen, negative. Opiate, negative. Barbiturate, negative. Benzodiazepine, negative. Cannabinoid, negative. Shinxaline, I don't know what that word is. Phencyclidine, negative. Methaqualone, negative. Cocaine, negative. PCP, negative. Propoxyphene or some shit. Anyway, methadone. Anyway, I'm all negative. My blood stuff tells me that I have very high cholesterol, but my liver is good. My liver's okay. My kidneys are a little bit sleepy. My sodium was low on the day of this test, which it should have been because I was not eating anything. I was having no salt. By the way, I'm feeling better. I'm not having the dizzy spells and all that crap anymore. For the past 3 days now, I've been feeling so much better. And I also quit taking one of the multivitamins that I was taking. I noticed on the bottle it expired in 2. Since I quit taking those, I haven't been feeling real weird and dizzy and wanting to pass out. It was the Mega Man from GNC that I was taking, but it was outdated. So with my blood work, a friend of mine across the street is a doctor, and I showed her this stuff, and she told me that I needed to change my diet, which I already have, pretty much, to lower my cholesterol, because I'm a walking heart attack, pretty much. I need to also take 1 baby aspirin every morning to thin my blood and make it slippery. And I need to be on a flaxseed oil or a fish oil, which will also be good for my cholesterol. My good cholesterol, she said, is great. The levels on that are great. My liver levels are all great except for there was one, she said, did you have a drink the night before the test? I said, I'm sure I did. I probably have a drink every night. And she said, that's all that is. That just shows you drink. She said, there's no problem with my liver. No major problems with anything. My cholesterol, I eat too much starch. I'm not diabetic, which is wonderful. All that's good. All those things are in range. And that's pretty much that, folks. I don't really know. I don't know what none of this stuff means. If you look at results, sodium, results 133L, I don't know what that means. Reference range 135 to 138. That's where you should be, and mine's lower than the low of that range. Potassium, I'm 4.8. I'm good on that. I'm within the range of that. Chloride, 100. I'm good on that. CO2, I'm 23, which 20 to 30 is good on that. So I'm within range on that. Glucose is 98, which is 1 point lower than the highest. Yeah, I just don't know what all this stuff means. Platelets, and there's all kinds of different stuff in here. Cholesterol, 276 is my cholesterol, folks. My triglyceride is 215. Okay. My HDL is 42. Non-HDL cholesterol, 234. Calculated LDL cholesterol, 191. Cholesterol HDL ratio, 6.6. VLDL is 43. And percentage of AC1 is 6.1. My estimated average GLUC or GLUC is 128. So I don't know what all that means, folks. Put your comments down below and let me know what you think it means. I think I already been told by my neighbor over here, but I'm still going to go to my regular doctor that I've been seeing and see what she says. That has nothing to do with my abdominal aortic aneurysm. I still have this aneurysm in my aorta, my abdominal aorta, which is the largest vein or artery in your body. I still got that problem. That trying to be referred to a surgeon. I'm trying to, get surgery done on that to fix it. That's just an update, folks, on my health. That's what I gathered from what I've read, from the reports that I've read, from the MRI and the CAT scan. I'll update you again when I see the doctor that can explain all this stuff to me, and let's find out what they're going to do for me as far as I mean, I guess maybe laser surgery or something. What do you do for, I mean, I know there's nothing you can do for arthritis and wore out joints except for take medicine. Bone spurs, you might I don't know, can you do anything for bone spurs? And a torn disc, what does that mean? A torn disc, how do you fix those things? I mean, is there things that can be done for the problems that I have? If there's anything you know about any of those, please comment down below and let me know what you know and your experience with any of the things that I've talked about here. And I'm going to go ahead and put a screenshot, which I probably already showed it to you. I'll put the screenshot back up of my report, and so you can read through it yourself and see what you think. By the way, the alligators, not the alligator, but another alligator is on film. I'll add that clip in here also. Yeah, I'll add the clip of the alligator in here right now so you can see the new alligator. He's only about 2.5 feet, maybe 3 feet at the most. And then I'll put the picture of my report on the end, so you can, if anybody wants to read the report, you can just go to the end of the video and read it there. But as far as that goes, thanks for watching, folks, and I'm feeling good. I'm not dizzy no more, and I've been told not to pick up nothing heavy because of my aneurysm, to not do a workout, just to take it easy until I can get it fixed, because I don't need to stress, I don't need to compress, I don't need to get punched in the stomach, this and that. I mean, if I fall off a ladder and hit myself, I get in a car accident and the damn seatbelt going across there, any kind of pressure on that, extra pressure on that aneurysm could rupture it and send me to the grave like that, just like that. So I'm still alive today. Well, I'm only drinking one a day. If I even do drink one, it's only one a day. I'm watching the squirrels gather nuts. Alligator out here today. See if I can zoom in on them without scaring them. There's the little baby. Little baby gator. Waiting on something to eat. That's where I threw all them pretzels and that dog food. Here he goes. He's going to take off now. No, he ain't. That's just me moving the camera. Yeah, he's taking off too. Just a little bitty gator. The turtle. The turtle might get eaten. Better watch out, turtle. Actually, I'd like to see a turtle get eaten by the gator. It's got a fat belly. It's eating something. That's one of the two. That's one of two that I've been seeing in here. That's the little one. He's probably there because I threw a can of Pringles out there today for the fish. He must smell it.